Hello, good afternoon everyone. Thank you for attending our presentation. So my colleague Jen Bray and I are going to talk about a service evaluation that we delivered from 2009 to 2011 on the development of a Dementia Advisor service in Worcestershire in England. We're briefly going to address the background and then move on to talk about the results of our evaluation, considering data collected on the work of the Dementia Advisor, and then some of the themes arising from qualitative interviews. Finally, we're going to consider some of the implications this might have for the development of Dementia Advisor services. We should acknowledge a whole host of people who were involved who are too numerous to mention this afternoon, but I think we should particularly thank the participants in the evaluation who were directly involved and affected and influenced the evaluation, and that's particularly the Dementia Advisers themselves and also the people living with dementia and their families who were involved in the evaluation. So the National Dementia Strategy for England identified the need for the development of early diagnosis and intervention services. A component of this objective was the provision of advice, information and signposting following diagnosis. The role of the Dementia Advisor was proposed, but as limited evidence exists for the provision of such services, the Department of Health identified a number of pilot sites to develop and evaluate the role. A collaborative project between NHS Worcestershire, Worcestershire Health and Care Trust, the Alzheimer Society in Worcestershire and the University of Worcester was successful in achieving some of the funding to pilot the role. 2 full-time Dementia Advisers were employed and commenced their role in December 2009, covering 2 specific localities in Worcestershire. The Dementia Advisers were to work alongside the newly developing early intervention dementia service, and so were very much geared up towards responding to people following their diagnosis. Although I'm not going to talk to this slide in depth, I just wanted to highlight that the evaluation included qualitative interviews on a monthly basis with the Dementia Advisers themselves, exploring their perspectives on the development of the role, as well as data collected from the client record system. Jen's now going to present some of the data from that system.
Good afternoon. So looking at some of the data that was collected via the client record system, we can see that during the 15-month period that we evaluated, over 300 people were referred to the Dementia Advisor service. And although slightly more were referred to one of the localities, the Wyre Forest area, than the Redditch and Bromsgrove area, in both localities, we actually found that the majority of the referrals were for the carers of the person with dementia rather than for the person with dementia themselves. And this caused a slight problem because they weren't the intended clients for the Dementia Advisor service. So it meant that the Dementia Advisors had to adapt their role to meet the needs of both the people with dementia and their carers and families. So where were the referrals coming from? The 2 main areas, the 2 main organisations referring to the Dementia Advisor service were the Early Intervention Dementia Service and the Community Mental Health teams. Although, again, the carers and the families were slightly different because we found that most of the time they were actually referring themselves to the service. Again, not as the service was intended. But we can see from the graph that overall there were actually quite a wide variety of different organisations referring to the service, showing that the knowledge of the Dementia Advisor service was becoming greater as the service developed. In terms of how contact was made with the clients, most of the contacts were actually via telephone calls. The nature of the contacts required a strong communication and organisational skills in the Dementia Advisors because they had to deal with phone calls, meetings, letters and emails. So they had to be able to communicate effectively across a wide variety of contacts. The phone calls themselves, although they were generally fairly short, lasting less than 20 minutes on average, could be quite challenging because they're often initiated by the clients. So the dementia advisors weren't necessarily expecting the phone calls, and they might also be the first time that a person had had contact with the service, requiring the dementia advisors to be able to think on their feet and establish a rapport with the clients very quickly and get across the information that they needed to. The meetings required a different set of skills because they were generally longer, anything up to 1 or 2 hours, requiring the dementia advisor to have a very in-depth knowledge of the areas. And overall, from the range of contacts, we can see that the dementia advisors needed a broad range of personal skills to go along with the communication skills. The dementia advisor role is actually very broad when you break it down in terms of the types of information that they were providing to the clients. They didn't just have to know about dementia from a medical perspective, they also had to know about a wide range of dementia-related topics, for example, social, emotional, financial and legal areas, requiring a broad range of knowledge from the dementia advisors. But in addition to this, in terms of signposting them onto the further services, they needed quite an in-depth local knowledge of what was available within their local areas. And to help with this, the dementia advisors created a guidebook of services which they could also pass on to the clients to help them find out about what was available. This did lead to some frustrations, as it was found that, unfortunately, there weren't always suitable services available to signpost people onto. You can't signpost people to something that doesn't exist. So hopefully that gives you an idea of the range of activities that dementia advisors were carrying out.
So the other aspect of this presentation looks at the qualitative interviews, and as I said, what I'm going to do is just present some of the themes related to that. One of the key aspects of the role identified in the dementia strategy was that it should provide a point of contact for people living with dementia through their journey with dementia. From the dementia advisor's perspective, in the interviews that we held, this was a key theme and a fundamental influence on the way that they worked. In order to achieve this, it was necessary from the dementia advisor's perspective to establish trust. And most commonly, this was successful as a consequence of face-to-face contacts with the people living with dementia and their family members. These face-to-face contacts were most commonly initiated through a joint visit that the dementia advisors had with the early intervention dementia service workers, so the nurses or psychologists who introduced them to the client. Where those contacts were initiated via telephone contacts, that relationship, it wasn't that the relationship didn't happen, but it seemed to be less strongly reinforced. And the dementia advisor's view was that people were less likely to come back to them where that face-to-face contact hadn't occurred in the first instance. What the dementia advisors also did to reinforce and support the development of that trusting relationship was to follow up that contact with either telephone calls or written information, often both. Also, what was particularly important was, and identified and highlighted the skills that dementia advisors need, was they had to, through that initial contact, work out whether the person was likely to be able and willing to initiate that contact themselves when things became difficult further down the line, or whether in fact they would need the dementia advisors to do that for them and to maintain that contact for themselves. A further key issue in the work that the dementia advisors did and was highlighted in their discussions with me was their assessment skills. I think it's fair to say that this wasn't necessarily considered or thought about, but what became very evident was the considerable skill that dementia advisors needed in order to ensure that they were able to hear and respond to the needs of the person with dementia and their family. It wasn't just a case, as they pointed out, of going in with a checklist, but rather actually, and as Jen referred to, often that meant quite lengthy and detailed conversations. It was about listening and hearing what the challenges that that person and their family were facing, and developing a very tailored and individualised approach to that person in terms of their support needs, which obviously requires a depth of skill and knowledge which is perhaps often not associated with a role that's deemed to be just about signposting. It's clearly a lot more than that. So assessment involved considerable interpersonal skills, including the ability to listen and to sometimes respond to the competing needs of the person living with dementia and their families. People didn't always have the same needs and clearly didn't always express those. So the Dementia Advisers identified a number of key functions or key aspects to their role. And I'm conscious of the time, so I probably need not to go through all these. But there were some particularly important ones. Signposting was identified as a core function, but as Jen said, it's important to understand what that actually means in practice. In reality, that meant quite a complex process in terms of knowing the area, knowing what services were available, but also recognising, and it highlighted some of the frustrations that the Dementia Advisers experienced, highlighting that often services might be available, but they weren't tailored to meet the very individual needs that some people had. And that was particularly the case where people had particular challenges around needing support to access those services. So one of the things that the qualitative interviews fundamentally highlighted was the importance of the core skills that the Dementia Advisers needed. These were involved and are actually much more detailed than I can highlight here, but they involved the importance of the Dementia Advisers being able to be resilient, to be enabling of clients. I'm particularly conscious of the presentation just now and talking about human rights and enabling people to make their own choices and their own decisions. That was fundamental to the work of the Dementia Advisers as they developed over time, and formed the basis of the way that they worked with people. That also meant that they needed to be able to be assertive and confident in their engagement with others. And that meant being assertive and confident with GPs, consultant psychiatrists, as well as with people in other in other professional roles. And that certainly wasn't easy at times for the Dementia Advisers. So finally, just to summarise, some of the things that would need to be considered in terms of developing Dementia Advisor services in the future are around the importance of enabling that partnership working to take place. That was particularly valuable in terms of them being allied with the early intervention dementia service. That really did and was, from the Dementia Advisors' point of view, a success of their work. And really, I think we don't have time to go through the other things, but just to pick up on one thing that I think was particularly important was the resilience of the Dementia Advisors. One of the particular challenges that came up was actually the emotional journey the Dementia Advisors themselves took in working alongside people and following them through their journey with dementia. And indeed, one of the Dementia Advisors said that and this is a person who'd been incredibly skilled, had done a fair degree of counselling training, and said that carrying out this role required walking alongside the person in their journey, and that could be emotionally very challenging and very enlightening and positive, but could also be quite difficult. And that therefore one of the things that she certainly felt, and that we would argue, is that the skills and attributes and knowledge of the Dementia Advisors are key issues that need to be thought about in appointing the right people to this role. Thank you.